Good day, viewers. I'm here again to continue our discussion on pediatric physiotherapy, and we'll be talking about ERB'S palsy this time. ERB'S palsy is as a result of birth injury. A lot of birth injuries occur during childbirth, and which can be avoided, like facial palsy. We have brachial plexus injury, and so on, can occur during childbirth. The ERB'S palsy I'm going to talk about is from brachial plexus injury. Brachial plexus is a group of nerves put together that supply the upper limbs, that is the arms and the neck. During childbirth, when the baby is coming out, if the shoulder is a bit wide, sometimes when the baby is pulled, this can affect the brachial plexus, and when it happens, it can lead to this topic we are looking at, ERB'S palsy. And the ERB'S palsy, we have what we call cervical spine from C1 to C7. This time around, the C5, C6, and C7 are affected in the cervical spine that results in ERB'S palsy. For ERB'S palsy, the symptoms that you observe when it occurs is that usually the child will keep that arm that is affected limp. If it's just one arm, because sometimes it affects both arms, but usually it's one arm, you will see that that child does not carry that arm. He's always keeping it limp, and there's a particular way he keeps the arm. Keeps the elbow straight, the arm stuck to the side, and the wrist is clenched and curved to the back. It appears like the waiter's tip, and we call it waiter's tip deformity. When this happens, we need to do assessments and diagnosis to be sure of what we have. X-rays are taken sometimes, and other assessments. Once it is confirmed, the treatment is basically physiotherapy. And what do we do there? We want to maintain the joint's range of motion in the joints of the arm. We want to maintain the muscles that are in the arm to prevent them from getting wasted and to prevent the joints from getting stiff. So you start right from day one. Once it is observed and it is diagnosed, the patient should be addressed from day one. And the treatment commences with parents involved, because most of the time the child will be with the parents, and the exercise has to be done regularly. For joint stiffness, what we do is do a lot of passive movements. You know, in children newly born, they cannot express themselves. They cannot tell you, what you are doing is okay for me, or, okay, you asked me to bend my arm, I'm bending it. No, you have to put in every effort to ensure that the treatment is adequate and well done. So for the stiffness, you do passive movements, which helps to prevent stiffness in the joints. Then for muscle maintenance, we do what we call free active exercises. But in the case of a child like this, what we do is assisted active by using some stimulation to encourage the movement of muscles that are weak. Like we have what we call tactile stimulation. We use simple things to stimulate the muscles of the patient so that he or she can move the arm in the direction that we want it to move. Then we also encourage the neck movements too for ERB'S palsy. Once it is not total paralysis, the patient should recover between 0 and 6 months if adequately treated. But in total paralysis, the patient may not recover all the muscles, but you must maintain the joint motion and also find out gadgets that the patient can use to make him or her independent, to live an independent and full life. So that is about ERB'S palsy. And they advise, nowadays it's reducing, it's not so common as it used to be in the past, because now even from pregnancy, the weight of the baby can be determined, and if it's a very big baby, immediately they switch over for CS instead of the natural birth, which can lead to injuries. So that has helped a lot to reduce this ERB'S palsy and other brachial plexus injuries that occur from time to time. Thank you.